Okay, yeah, thank you guys. It's a pleasure once more, and yes, as you can see, I realize that some of our participants are actually joining for the training, and more like our webinar. No, I wouldn't really say the training. So if you're joining us for the first time, this is actually the first time we are having an online webinar that constitutes students of public health from various varsities in southeastern Nigeria, and this is what we want our students to be having. This is actually an interaction that is going to not just be that regular lecture that you've been having in the university, but this is that interaction that can actually lead you into action. And that is why we decided to host this program as part of the objectives of this association, the Southeastern Association of Nigerian Students of Public Health. So it's a pleasure once more. And to get started, what we're going to be talking about today is something very insightful. And I know for a fact that if you're a public health student out there, it might seem as though we are ships or whatever without shepherd. But I want to let you know that this is actually an opportunity and a time that we can actually get to explore, make a lot of money, and also have a very significant impact in public health. And this is that time that you've been looking for. Quite very stressful as of the time of making this recording. A lot of students are actually engaging in their exams, but I saw it as something that can actually put your exam as a distraction for you, because you know the value that you want to take out from this webinar. So once more, I want to introduce myself. My name is Innocent David. I'm a graduate of public health, and I happen to be the Southeast representative for National Association of Public Health Students in Nigeria and Senglen. Okay, so we'll be talking about artificial intelligence in public health. We live in an age whereby generative AI happens to be what is trending, right? Generative AI all outside of there. I'm sure everybody uses ChatGPT, not just ChatGPT. You have Meta AI on your WhatsApp. If you open your Instagram, you have a lot of AI-assisted chatbots. When you go to the hospital, or let's say you're a data analyst or whatever profession you happen to be taking up as a public health student, you realize that in one way or the other, artificial intelligence has now come to play. And as a matter of fact, in terms of finance, digital, anything as it relates to digital, currencies and all that, AI is now in place. And we need to actually understand how can AI, what role does AI have to play in public health? And that is the reason for this webinar. So this webinar is going to be uploaded. It's going to be out there for you on YouTube if you really want to follow up on some of the conversations that we are going to be having today. So I hope this conversation happens to be a very insightful one, and one that can actually take you into action. So as a matter of fact, we're going to be taking a very detailed outline. And first of all, we'll start by identifying what is actually artificial intelligence. So let's assume you just came from the village, or you just came from a very rural community, and you don't really understand what artificial intelligence happens to be. In an area of artificial intelligence, what is it really defined as? So many people are talking about AI, but if you can actually sit somebody down and ask the person, what is an AI? What is an AI? What does AI really mean? People might actually find it very difficult to discuss. And after that, we're going to look at some of the tools, pathway using AI. We'll look at some of the key areas of AI in public health. Then we'll take a look at what is really trending. We'll look at generative AI. Then we'll look at opportunities of AI in public health. And then we'll look at some of the ethics and how do we get started? What roadmap do we really need? to actually get our hands on AI in public health. So I hope it to be a very insightful one, and as usual, it's going to be very, very, very interactive. We'll get to converse. I believe I don't have people who are watching your video in any secret society, because many times when people actually join webinars of such, they get to, put their face behind the camera. But I will be really open to listening to you and hear some of the contributions that you might actually have during this conversation. So stop. I was asking to stop. So why am I asking to stop? I just hope you haven't forgotten what we want to talk about now. We're talking about AI in public health. So we're going to put it in this way. We're going to first of all start by talking about what is AI. Then we'll talk about AI, public health, right? AI here, we've got public health. Look at areas in public health. Look at AI. And now marry them together. Just like you actually get married to your boyfriend while you're still in school. Because most people, while you're still in school, you get married, you graduate, you remarry again, and all that. So that is how we want to form a very beautiful union between AI and public health. So let's jump right in there. So this is actually a very beautiful picture out here, but has numerous errors. So this picture explains everything we're going to talk about today. When you look at this picture, you find out that I could tell you for a fact that this picture was generated using AI. AI was using generating this picture. And when you look at this picture, or look at the images in this picture, you find out that some of the terms here, we want to look at some of the areas of public health. Epidemiology, not really very clear. Biostatistics, health, lots of health, global health, not really global health now, and lots of other things here. Here we're trying to talk about occupational health promotion, but you see some errors here. So this is what AI is doing to us these days, because whereby we see a lot of people trying to get into it, but they don't really have very good knowledge about it. But now we're going to look at how can AI be applied in public health, and what are the ethics that you actually need to undertake while you're looking at AI.
We can't see your screen, sir.
Okay, so I'm going to put that back. I'm sure that might be coming from you. My screen is clear. I'm sure you guys can see my screen, right? You guys did see my screen?
Yes, please, I can see your screen.
You can see my screen, right? While I was presenting.
Yes.
Your screen is your screen is very, very clear.
Okay, thank you very much. Okay, cool. Yeah. Thank you for that. So now we'll move on to the word now. So this is where we come into the word now. What is artificial intelligence?
No, I can't see your screen.
What is artificial intelligence? Yes, true. What is artificial intelligence? Now, when we talk about artificial intelligence, we think about artificial intelligence as you're cutting the vegetables in your kitchen, right? Now there's a rationale that your mom gives you vegetables to cut, and she expects you to slice that vegetable. Or let's use an example like tomato. Maybe your mom gives you, let's say, a couple of tomatoes to slice. Now she expects you to slice it into 4 different halves, right? Now, what is artificial intelligence now in this scenario now is like your human intelligence expects you to slice it into 4. Now, instead of you being the one to do it, something else gets to make that decision that the tomato needs to be sliced, even if it's not into 4 places, but at least it has to be sliced. So what is AI in a very conventional definition? AI is all about the use of machines, algorithms to simulate human intelligence for solving problems, right? So this is just blah, 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 blah definition. This is just definition. We're going to have a more detailed practical look at it. So we're talking about using machines. Now, what is thinking? You want to go visit your boyfriend, or you want to go visit your spouse, or you want to go visit your friend. You begin to miss the person in your brain, right? Now, instead of you being the one to think about that, artificial intelligence now is more like what? It begins to do what? Simulate that human intelligence. You train a robot to begin to think that this is time for you to go and visit somebody. You're not the one doing that particular thinking. So this is just more like a very, very layman's definition of what it looks like, right? So the machines, like, right, they are being they simulate human intelligence for solving problems, learning from data, and making decisions. So lots of times, whenever AI is making any decision, let's say you put on your chatbot, define computer science or define public health, right? Whatever thing that is being generated is as a result of a training that that particular data or that particular AI data set or AI technology has undergone. So what's the importance of AI in public health? Like, what importance can AI have in public health? Because as public health students, we are struggling with one particular thing. And what are we struggling with? We are struggling with not knowing what we should be doing. As public health students, we have a battle to fight with clinicians. As public health students, we have a battle to fight with environmental health officers. We have a battle to fight with loads of people. It looks as though we don't have a place. We don't really have a place that we can say, okay, this is where we have to function. But I want to tell you the good news that with the surge of AI, we have a role to play. Now remember that AI can help you in analyzing complex health data. It can help you to predict disease trends. AI can help us to optimize health delivery. Now we are getting to the point whereby a pregnant woman will walk into the hospital and we could just type, perform an operation on her. So AI has to now learn from data from people that has had or has undergone maybe cesarean section or natural delivery method or whatever, and begin to do what? Cut her into what? To get the baby out and also save her life. That is where we are getting to. So by optimizing healthcare delivery, we're talking about artificial intelligence doing what? Helping us to solve those complex health data. Let's say you're somebody here and you're in final year and you're trying to do your data analysis. We are getting to the point whereby you can actually upload your questionnaires on ChatGPT or on any type of AI tool and ask it to do what? Analyze this data and actually generate meaningful trends for me. That is what we mean by AI in public health. When we talk about AI in public health, we're trying to see all those things that we are manually doing with our hands, struggling to do it, right? Rather, we get to use these machines to do it for us. That is where we are. So it's either you're in the game or you're not in the game. We have gotten to the point where it's either you're in the game of AI or you're not in the game. AI is not going to take away opportunities in public health. Rather, what AI is going to do is that it is going to make somebody who is an expert in it to do what? To take away your own job. So you have to do what? Learn in details about how these tools works. There are diverse of them that we're going to explain on the long run. Now, what are common examples of some of the applications? I just want to give a snapshot before we go into details of what we have. Now, AI can be used in disease outbreak prediction. Now, let's say, for example, now we have data. People are submitting their data in the hospital. When you walk into the primary health care, at the front line there, people are dropping data. Let's say somebody comes in, does urinalysis, the lab data, they submit the data. Somebody in Jigawa State walks into a primary health care there, does urinalysis, submits their data, it's being recorded. Somebody in Taraba State does the same thing. Somebody in in diverse areas, they are all doing what? Submitting their data. Now, what do we now mean by disease outbreak prediction? Now, when we now have so many of these data, I understand that in our primary health facilities, there are not really so much automated computers, whereby you walk into a primary health care, you see people on their laptops and all that. Most of our primary health cares are very, very dilapidated. Now, how can AI now help in disease outbreak prediction? Because most of the time when we make all these some things like this, it looks as though we are speaking big English. Now let me explain it in detail. Now, when people have now dropped all those data, now let's say, for example, all those data that people are dropping as various, point of entry in any facility, maybe be it in the hospital or in the primary health care or in the tertiary health care service. Now, when they are being uploaded online, it will now be easy for artificial intelligence to now read based on the fact that it has been trained with data from COVID-19 outbreak or monkeypox outbreak, Ebola outbreak, cholera outbreak, and all that. So when it is now getting all this data, it can now be able to say, okay, I think I'm observing something now in this particular area. That means this so and so might actually happen. This is a very, very simple example. So when we talk about disease outbreak prediction, with the data we are submitting at the health facilities, it will now be very, very easy for us to, for AI, for artificial intelligence systems, which we are gradually working into now, because most people can actually call it the mark of the beast or whatever thing you want to call it. Now, these machines, these robots will be able to do what? Predict if at all there will be a what? Disease outbreak. This is something it can do, not like it's something it will do, but this is a potential that the AI has in its application. And again, as public health practitioners, we must keep abreast with some of these things. Also, personalized health interventions, monitoring public health challenges like epidemics, just that is just something that I've actually explained here. Now, this is where the game begins now. Now, the question now is, we have a very big challenge while we are public health students. We really don't know where we're heading to. When you ask your friend, or let's say you have an ex-boyfriend or an ex-girlfriend, sorry about that, I'm sure they were very hurtful to you, and you ask them, maybe let's say they were in a department like maybe materials and metallurgical engineering, or let's say they were in chemistry, and you ask them maybe at their final year or maybe during the master's, you can ask them, where are you really specializing? They can tell you, oh, I'm interested in materials, I'm interested in this, I'm interested in water treatment, I'm interested in underground engineering, whatever bullshit that they are interested in, right? Before you parted ways with them in that relationship. Now, the problem now is this. In public health, we need to know our area, our field. Now, look at this umbrella here now. It's very broad. There are still lots of areas. We have reproductive health care, we have primary health care services, which is so broad, drug delivery, epidemiology, disease control, disaster management, lots of them, right? We have occupational health care. They are not all captured here. But the point I'm trying to say is that before you start talking about where AI can actually apply in public health, you need to know the area that you are in public health. That is why biostatistics is usually very, very recommended for public health students. It is very, very, very recommended. In your AI journey, statistics is going to be really, really very paramount. And that is just it. So what is the point of this slideshow? The point of this slideshow is that we want to actually have an understanding of several umbrella areas in public health. So that's it. Now, what are the tools and pathway technologies for AI in public health? Now, there are diverse softwares. For you to become very conversant with artificial intelligence in public health, you need to actually learn and understand several of the several of the, let's say, data science tools that are very imperative. Some of them it's always good for you to have hands-on on Python. Python is actually a very good data science language that is very important, very imperative for data analysis, very pertinent for data science. So personally, I use Python for meta-analysis whenever I want to do any form of review evidence and research. It's very pertinent. Helps me in reading my data and gets it very done. Python is also used for programming, but we're not really looking at it from the programming standpoint, but in terms of several AI tools, we are drawn from some of the Python libraries. When you look at some of the chatbots like ChatGPT was trained using TensorFlow and PyTorch, and these are one of the largest libraries of Python. And let's say, for example, you're somebody in public health. One of those pathways that you can start thinking about a problem to solve. Many times we are all logged on thinking about how to submit manuals, how to do a lot of nonsense. a whole lot of bullshit that are not really, that doesn't really have any impact immediately we leave that gate in the university. But we need to look at AI from this standpoint that you can actually decide to start your AI company while you're in public health. I know most of the lecturers might not really be telling you about all these things. Now, we have the Python application is really going to be helpful. It can help you to develop chatbots for sexual education. Let's say this is an era whereby people will log into ChatGPT. They're asking questions like, what can I use in preventing unwanted pregnancy? Or what pills can I use in preventing? Now, this is a chatbot. But you need to ask yourself, what was used in creating that chatbot? ChatGPT was created using TensorFlow. I said it now. TensorFlow is one of the largest libraries for Python. If you're somebody that's very conversant with programming, you're definitely going to know this. And another tool there is R. R is also a very magnificent software. You actually need to start that in your pathway. It's really going to be helpful. Data science, data analysis using Power BI is very, very pertinent, because what is trending now is that so many of these technologies, they are now inserting AI bots inside of it. So you don't need to be dulling. You don't need to wait for when you graduate and start carrying your file to go and do NYSC or work in one primary health care, or look for when you get one job in one hospital and all those things. No, you need to get yourself in line with some of the latest tools. Do you know how to use Python for data science? Do you know how to use R? Do you know how to use Power BI, SQL, SQL? Can you use these databases? Do you really understand what the pathway for research in public health? Those are very important. Like, those are the things that are going to give you that acumen for you to have hands-on pathway forward AI in public health. So another thing there is databases for public health research, like the CDC, WHO, PubMed. These are some of the tools that are lately powered using AI. You know, what's AI? Remember, AI is just you give a command, it does what you want. Very, very important. Machine learning is also another pathway. Machine learning algorithms in healthcare. You know, when you walk into the health facilities, we need to be thinking about the tools. We need to be thinking to the tools, to the problem solving. Very important as well. We're going to also explain that in details. Natural language processing is also a very, 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 very vital. This is a very, very vital aspect. And also mobile health technologies. How many mobile health applications do we have in place? You need to be thinking about these things. They are very, very important. Like, you create an app create an STD app. You can create an app that can give awareness on sexual transmitted disease. You can create an app for pregnant women to check their time. You know, you can create all these apps. These are AI. These are AI era. So when you create all these things, you're not just thinking about having applications for TikTok. You have applications for this. You have TikTok. You have Instagram. You have Reels. You watch all these things. You're really yourself, but you are not really thinking about your own application, AI application. So these things are some of the tools. Public health is all about prevention, and people need these applications to keep in touch. And in turn, you make a lot of money from it. So remember, I've talked about some of the data science tools, talked about getting all these applications, getting in touch with research, and also developing mobile health applications. Back while I was in school, I'm a member of the Interdec research group. We got a grant. Then the grant's worth $200 and something thousand. That was headed by my head of department then. And before then, we already had an application that we came up with, a no malaria app. I think some of the students then initially worked on it as a project, and it was really groundbreaking. So when you go on Play Store and you search for the no malaria app, this is actually an app that educates people on how to use how you get information about malaria, try to differentiate it even with COVID-19. And I'm just going to show a quick example of what I'm talking about, this application that I'm talking about. So it's not going to look as I'm just talking about. So when you type no malaria app. So this is the no malaria app. This is it. Here you can actually download it on Play Store. I can actually show you the image of what this app looks like. So this is it. This is it. So we created this application software to educate people on how to use malaria, or how to identify malaria symptoms. And yeah, and that's it. So this is what we mean by mobile health application. So you can actually come together with your cartel, form a group, and start something. So quickly, what are some of the key areas and tools of AI in public health? Some of the key areas. We just talked about some of the pathway to getting there, and we need to actually know some of the areas. And when we talk about drug discovery, as a public health practitioner, drug and vaccine development, you have a road there. So this is PyTorch, DeepCharm, AutoDoc for molecular modeling. All these are AI. All these are AI contributions. More like these are AI contributions in public health. Also, health system optimization. You really need to know how to use some of these tools like Microsoft Excel, Tableau, Simo 8. Very, very massive. They are really, really very, very massive. And again, it's data analysis for public health policies. It's short as at the time of recording this, I have a data analysis training coming up where I'm going to be showing some of the basics of Python and SPSS for public health students, right? With Python, you are really unstoppable because when you look at some of these PyTorch, DeepCharm, so many of these are some of the libraries for Python, Seaborn, Matplotlib. You have ggplot2 dplyr for R programming language. So some of the key areas here is that data analysis is very, very important in public health policies. When we say that 90% of people have tuberculosis, that's a very, very rough example, right? That seems very careless. Let's say 90% of the people in a particular sample population have tuberculosis. How are we able to come up with that 90%? It is through what? Data analysis. And that's just it, because when you look at the beginning of 2024 in Q1, when we talk about Q1, that's from January to about that March or thereabout, WHO published that about 2 million abortions has already been performed. How were we able to come up with that data? It is through what? Data analysis. And as public health practitioners, it is very, very pertinent that we understand how to use several of these data analysis tools. They really make a lot of sense in us doing what? Getting in line with some of the AI trends. So you need to be in the game. You really need to be in the game. So other areas are like, I just talked about them already, disease surveillance, outbreak prediction. Personally, what I'm doing is I'm just trying to show you what is available, lots of them. Then you can now select the areas that you can actually do what? Get into. So disease surveillance and outbreak prediction, I already explained that at the beginning. Let's say, for example, you train the data. How can we actually get this done? Is by doing what? Knowing how to use some of these tools in Python, like Pandas, NumPy, Power BI for data analysis and visualization. Very, very massive. In short, knowledge is free now. Knowledge information is free. You can actually go to YouTube. You can actually take 10 hours course on data science, and you're already done. You're already made. And that's just it. But when you decide to wait, when you decide to waste your time, when you decide to ruin yourself, mess yourself up, doing things that are not really helping you, it's up to you. And that's not really a good decision. That's very terrible deep down inside of you. So personalized health interventions like chatbots, applications, customized health advice, they really, really help. When you look at some of these guys in their 20s that are millionaires, you find out that most of them are actually just scaling one AI intervention or scale one tech tool, and you're already made. So our public health students, we don't need to be waiting for when we're going to have a framework or a body or a model that is going to shape us. But no, we need to learn how to take up the skills now. If you're somebody that you like maternal health, you can actually think about How can you and your friends come together and come up with an app? Who knows what tomorrow is? Who knows where it's going to take you to? Who knows? There's no skill. That's actually a joke. Just learn them. Now we're getting to practice here just to see one of the mind-blowing things. And I'm just going to show some of the popular generative AI tools that we can't afford to miss out on. Personally, I know how to use ChatGPT. In short, I've had a full course on ChatGPT. ChatGPT is not really what you think. Most people think ChatGPT is just all about you juggle it in, you just give a prompt, you ask any random question, and it gives you an answer. No, that's not really what it is. You really need to know how to be very detailed with it. You know how to give a detailed prompt with it. And I'm just going to show an example. I'm going to select one of these and show you how I can actually practically use AI in something that relates to public health. We are definitely going to see this right away. But before I show you that, I'm actually going to talk about some of the applications of generative AI. Now, AI tools has come to stay, right? And like I said, you can be working on something related in public health. You can use AI tools that I've talked about here. Some of these like Synthesia, AlphaCode, Compose, DALL-E, GitHub, Midjourney, ChatGPT, Gemini. You can use any of them to generate an art or design. You can use it to write a music script. You can use AI to create your content. You can use it to suggest content. You can actually ask AI tools to give you an idea, for your content creation. Let's say you want to create you're just in final year and you're thinking of what to start, and you want to start creating content around public health. You can actually just put in a detailed prompt and tell AI what you've done in public health and ask it to create a content script for you. It can help in visual words, it can help you to design your product. In short, AI now is already helping in is now an assisted, coding, framework, and it helps in financial forecasting. People in forest can actually attribute this. You can actually use it to understand consumer behavior analysis. If you're doing somebody that is into marketing, demand forecasting, healthcare diagnosis and prognosis, somebody can actually walk into the theater. High AI diagnostic tools in developed countries like Japan, you can actually just give it your prompt and it's going to run the diagnosis. Also, the banking sector using AI for fraud detection. It's really, really, really very massive. Remember that some of these are generative AI tools that are now very, 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 very what? But I'm just going to show us a snapshot of what ChatGPT, how powerful ChatGPT can be. Remember that one other thing I always want to add is that you can always use AI. You can always use AI to support anything you're doing. What makes you intelligent is not really how it's not just all about the amount of information you use, but how adaptable can you be? How can you adapt in a new environment? Like when you're put into a very phenomenal situation, how can you be able to adapt? Now, many people identify me to be a systematic reviewer. In short, by the beginning of this month, I had about over 100 citations in research. And this is something that is actually beating what loads of lecturers actually have there. And now, one thing for sure is that since people really identify me as a systematic reviewer, 90% of the time, that is not really maybe what I do, in as much as I teach it and I practice it. Sometimes, try to do it. I'm very good with it. But that's not really what I do, because lately I've really been working remotely on legal research, something that's not really related to public health. And I was able to adapt very well, very, very smoothly with it because of what I understand how to process all of this. And this is something I actually expect you to have very massive knowledge on. It's all about how can you be able to adapt when you're put in a very tight situation. How can you be able to come up with something very decent instead of messing yourself up on TikTok? You can actually decide to spend a very good time in aiding yourself with some of these AI tools because the gap is gradually closing. And the earlier you fit yourself into some of these tools, the better for you. So that is what I'm actually going to be talking about now. And like I said, these are some of the applications of generative AI, just like we talked about. We just want to keep this conversation very short and simple. What then could be the opportunities of AI in public health? Data science is very massive. That is where we should be looking at. It's going to really create a career path. AI provides a career path, in data science for public health professionals. In terms of research, you have lots of opportunities there. Grants, there are now lots of grants. I told you guys about the recent grants that we got last time, worth $200 and something thousand. We've got to travel for some of these grants. That was something on that was something on NTDs, right? So something on neglected tropical disease, which is also another aspect of public health when you talk about public health parasitology. And also part of what happens to be the specific objectives of our grant was still kind of data science, because we're trying to match images from people who are actually affected with some certain types of neglected tropical diseases using what? AI. That is, some of these AI tools we are helping in matching these images. When you take photos of people who are actually having some of these manifestations and put it out there, you see AI tools getting to match it. This is schistosomiasis, this is lymphatic filariasis, this is that. And all these opportunities are out there for you. So you don't need to be sleeping. You need to be awake. You need to be angry. You need to be pissed off that you are ruining your life and that you're not doing what you should be doing. Also, another opportunity that AI presents when you are really a very top professional with AI is that it helps you to collaborate with tech organizations and NGOs, right? So you need to be very flexible, just like we said. Somebody in public health, you have very great data science skills. You can code. It's basic code for public health research, and you have that capacity to collaborate with companies that can in turn provide mobile health solutions. So you see that you now have a lot of things that are now lagging now. Another thing that is freelancing opportunities, right? So if you're very good with AI, it can make a lot of money through freelancing, get some knowledge, get some skills. From time to time, I do always organize research training, research writing skills. I've got loads of them coming up next year, early next year precisely. And it's something you really want to make sure you participate in. And they are paid trainings. They are really paid trainings, very paid trainings. So also, it also gives you a very beautiful portfolio. I've got a client call me sometime from India. They saw my publication, one of my AI publications, and they just reached out to me from LinkedIn, called me on phone. I got a gig because of what? I've got a portfolio. If you don't have the portfolio, it's going to be really, really very, very difficult for you to make that name. You need these results. You need results. In short, people listen to you better when you have the results. When somebody goes to your publication, goes to your research gate and sees that you have 100 publications, they don't need any other evidence than to give you the job because you happen to be the right person for it. But what if you were just messed up? You have nothing to show. You only just on your phone scrolling, watching lots of celebrities who don't really give an ass about you. That is not what you should be doing. You need to be doing what? Getting yourself sick. I'm going to tell you that the exams that you wrote today are very useless. Like, they might be useful if I thought they are going to give you a type of result that you're going to use to build your portfolio. But if it's in terms of you just writing it to maybe you spend time there, it has little or no relevance. It has no relevance because what is going to put food on the table, it's how valuable that you are. And you're not going to be valuable in public health if you don't become exceptional. So these are some of the opportunities that are out there for you to explore. Now we're going to talk about some of the ethics. That is where it leads us to. What are the ethics? So the problem is not just all about generating it. We need to be very security conscious. We need to be very responsible because many times when people are introduced using chatbots, you just generate something from ChatGPT. just paste it. You just feel like you've got the information, but really you haven't. And that is because you don't have what it takes to do your proper cross-checking. So AI can be biased sometimes. So these are some of the threats and ethics that we need to actually adopt. So we also really need to feel very safe with using AI tools. Very, very important. Very, very, very important. And transparency is also very, very important. Now, what is the roadmap? That is the point now. How do we get started? That is the next point. That's the next question, because all these things that I've actually said is now enough. But how can one now get started? Where do we now get started? So I'm trying to fit myself in your shoe. I understand that you're now so crowded with lots of information. You can't wait to start learning Python. You can't wait to start learning maybe Power BI. You can't wait to start going on YouTube to get videos to at least have a much more better use of your brain chemistry, not the cheap dopamine that you get when you scroll on Instagram Reels. But rather you want to really make everything count. And that is where we come in now. Now, there are some of the skills that we really need to get. One of it is we need to understand how to do our data cleaning, visualization, basic machine learning. It's very important for us in public health. We need to start taking the data science pathway, get in touch with Python, basics. Next session, I'm going to show us how we can actually install Python. I'm going to send videos about that in the group. And you have to start working on projects. But remember that it's not just enough for you to have all these tools, but you need to work on projects. You really need real-time projects to work on, because if you're not working on projects, it's going to be really very difficult for you, right? So you need to explore several AI applications. You need to join communities. Joining communities is also very important, because when you find yourself in the right environment, you tend to grow. Now, let me now tell us something that we really need to know, and that is this. The very fastest way of starting is just very simple. Number one, you need to sit yourself down and ask yourself, what do you really want in this life? What do you really want from public health? Why are you really wasting your time? Why are you really wasting your time going to classes? Why are you really wasting your time going for like practicals? Why are you really wasting your time, or are you really making it count? Let's say, for example, AI in public health, you want to start as a public health content creator. Now, instead of going to class being a waste in public health, you can make it count by recording all the 500 days that you spend in as an undergraduate. Every day you go to class, you can stand somewhere in the class and create content in public health about it and post. You have to start now. Now, everything is not data science in terms of AI. Everything is not really data science. Some things are also content creation, maybe it could be designing, creating logos, voiceover, artistry. Some of these things are actually very important skills that you can actually have in public health, right? But you need to have the starting point. Consistency is very important. Yes, I understand that sometimes consistency can build a bad habit, but then whenever you're growing, consistency is that right engine that can actually help you to grow in public health. Remember that this thing that you're learning today, or this information you're getting today, nobody really gives a fuck about it. Nobody really cares if you're going to finish. Sometimes you need to ask yourself, so many public health students that graduated in 2012, where are they? Where are the people that graduated in 2014? Where are the people that graduated in 2020? So what contribution have they now made that you can actually, you that is in final year, or you that is an undergraduate, or you that just graduated, can point at to say, this is the link, this is what is trending, right? Remember, these are what are trending. When I talk about what are trending, these are some of the things that are trending. So you should ask yourself, how can you really get started in public health? Like, what can you really do right now with your life to make yourself something better? Now, I promised to show us something, just a very snapshot example of how I can actually use ChatGPT. I'm just going to do that. I'm going to create something very simple. I'm just going to make it very simple and easy. And now, what am I going to do now? I'm just going to give you just a very simple prompt. And that prompt is not it's just going to be something I expect us to do. Let's say everybody's already very conversant using AI tools like everybody's already very conversant using AI tools like ChatGPT. You ask ChatGPT lots of questions and all that. But we can actually make an attempt now. Also, I can actually ask ChatGPT. I am a public health. Let's say, for example, public health student that just graduated. Let me use, for example, Abia State University, where I studied some of the. Now, I'm trying to get you guys' hands on something. I just want to show you how you can actually give a prompt, right? How you can actually apply AI and how you can use this thing to develop a work layout for yourself. Now, let's go. Let's dive into it. So I'm an Abia State. I'm just giving. So if you're listening to this as a podcast, you have to understand that I'm just giving a prompt now to ChatGPT. So you can actually give that prompt by pulling out your phone, and you also do that. So thank you. So I'm a public health. So let's go with the prompt. I'm a public health student that just graduated from Abia State University, where I studied some of the following courses, which include. Okay, so I studied Introduction to Public Health. Let's see, Public Health Promotion. I studied Control of Communicable. So this use of standing order, the management of minor ailments and injuries. Now also, I can also add there, I studied, maybe we can actually add public health microbiology. Now remember that for me to have said I'm a public health student, so to understand some of the courses that are required of public health, but I want to still be more detailed and specific in my prompt. Let me drink water. Public health microbiology. Looks like I have life for me now. Okay, then I studied information. Some education. Also, maybe you can actually, we can also add so this is some of the classes, applied epidemiology, infectious disease epidemiology, and this control. Now let's move mostly to the rain semester where we always anthropology is also it's also a very good course. Public anthropology, and we have out information that I've added that. Okay, I'm gonna take that out. I'm just going to put yeah, I think this environmental toxicology. I'm gonna move to the next one. I'm gonna see emergency services. I'm speaking randomly because I know maybe some people from APSU or Yoruba might not really be conversant with it, but I'm sure these are the basic courses that we actually really study. But because so these are health problems, special groups, and also what other courses do we really getting? And so we also got with primary health care and alternative medicine. We have occupational health, we have occupational health. And later we have entomology. We have this is Spain. Now, I think I'm okay with that. So if you're in public health, it doesn't, regardless of the level where you find yourself, these are just courses that you've studied in public health. Now, or at any stage, you can actually do it anyhow you want. But I just want to show you guys how you can actually be very, very detailed. Now, can I say now? I'll tell you now, based on these courses. I don't really know what to do with my life. Wow. So please, I want you to be very helpful in constructing a detailed task for what I am going to learn. And because of the fact that I attended a webinar on artificial. What's the title of this webinar? This is artificial intelligence. Public health. Okay, more details. I'm also going to add. Okay, I'm going to leave that there. I'm going to go down again. Now, I'm even thinking of navigating through data science or maybe content creation, where I can be making videos every day that can now help me. Okay, let's put it this way: data science or data analysis or content creation, where I can be making videos every day that can help me attract NGOs and brands, or writing, or I commence research writing, okay? Or writing creative public health blogs or articles that I can't be. I've already told you people that you should be on LinkedIn. Everybody should be on LinkedIn. Like LinkedIn is not TikTok. You know, already most of us are already messed up because we've watched so many TikTok videos that we don't even know what LinkedIn means. So LinkedIn is a very beautiful application for you. I'm just going to open mine. I'm going to click on LinkedIn quickly to just get mine opened, or just click on this. Right, so this is what my LinkedIn profile, this is what LinkedIn means. So I return back there. I can be posting us, whatever. Now, generate a detailed action plan. Now I'm going to increase this so that we can see this. Okay. Generate a detailed action plan table for me to work with this January 2025. So my life will not be so messed up. This table because like to action for me. So that's it. So I'm sure most of us here might be wondering, what is this guy really writing? Like, what's this guy writing? Yeah, this is how you talk to AI tools like this, and you get to just be very detailed with it, tell it exactly what you want to do, and be very clear. So I think we're good to go, but this is just going to be a dummy. Remember, when you get anything out, you've got to edit and all that. So I'm just going to hit that in there right away, and so it does what I want exactly. It must do that, and that is it. Okay, cool. So now, what's telling me for me to do by date? You know, most times, what you're looking for in what are you looking for in what do you call it? What you're looking for using ChatGPT, you're just you come there to ask questions, like you ask questions like, how do you know about so and so medication? How do you know about this? How do you know about this? No, like this is like an opportunity for you to like go detail, like tell it what you want. Like you need to have a planned life for the first time in your life. So now this is what it says now. So it tells us that for the first time you're becoming useful. From January 1 to 2, it says that we should set our goals and organize your space. So what are some of your goals? Maybe you want this, learn Python basics or R, from this to this. That's fine. Online courses like Course X, or YouTube, what you should do. Now, you need to brainstorm content ideas, create a list of 10 to 15 blogs. Now, this is actually a more open table. I see how it has planned your pathetic life, and your life is now beginning to have some shape. And now you start learning video editing. So that means that this should have come in December. Some of this should have come in December. So when you walk into the new year, you have a day-to-day plan. I'm going to show us how we can break this table down further now, in a situation whereby we can now have a more detailed action for, let's say, January 1, what you must do in January 1. January 2, that is the way to live life. You don't have to live life by chance. You wake up in the morning, you go to school, maybe you copy notes, maybe you feel like you're a good student, maybe you even finish with a first class. I finished with a very high CGPA, right? Cool. Now you finish with a very good result, maybe another, but you're messed up because you don't have any advantage, you don't have anything to show for it. So this is it. Plan it down to what? 31. And now what we can do here is that rather than do it, if you want to make this was already very clear for me, but if you find this, if you're finding this thing a bit still bigger, right? So you can actually ask it to break it down. Okay, how I can do that is I'm going to just come down. I'm just going to click on this. The same way you reply your boyfriend's chat here. Okay, there's something that comes up here, but I'm going to do that again. I'm going to highlight that again. Now look at this. So I'm just going to hold that. So for you to know you're replying the specific chat that he sent to you, that's something. I'm not going to ask you to break it down into more simpler form, like exactly what I should do. Now, let's say we want to now go into, maybe content creation in public health. Content creation in public, you want to take your life serious, you want to make yourself, you want to add, contribute, not consume. You don't want to continue consuming, but you want to contribute. So, okay, you say, okay, now, thanks a lot. Thanks a lot. I can say, come here, say, thanks a lot. Please, my G, my God, can you help me break it down in a more simpler form? Because like this, I want to just learn Python, or I want to just learn data science. Let me not say Python. So I'm not the one choosing your future for you. You might decide to learn SPSS or data analysis or learn any bullshit that you're interested in. Learn data analysis. Like that's the only thing I want to learn. So I can have more clear focus. Just give me the table of exactly what I should do each day. More like the task I should perform. Okay, and the hours per task. So hit that in. It's now clearer. We've made a choice. Okay, so that's it. So you said January 1, set up your workspace, install tools, organize your study area. So first thing I'm gonna do, so let's say you're in my room, you happen to be in this room with me, right? In this very single room. So what you gotta do is you have to set up your space, your workspace, and you get your laptop. Very important. Remember we have something that's ending to this where I'm going to be giving out laptops. I decided to give out 6 laptops to you guys. So now you get your laptop, and once you get your laptop, you install Python. You just watch a video on installation. You have achieved something for what? That's January. Now, if you don't want it to be Python or you want it to be another thing, you're still free. This is AI application in public. This is the generative AI we use every day, but we can't use it. Now, then day 2, you dedicate just 3 hours of your time, because everybody has motivation. You can spend 12 hours scrolling on TikTok. So you're not motivated you're disciplined to TikTok. That's 3 hours. So you can just take out 3 hours out of it, watch some beginner-friendly videos in data science, basics, and all that. Now, you see, it breaks it down further now. Now, inside of Python, just only that next day, day 3, you just watch videos on variables and loops and conditional statements. YouTube, you're going to get it. Day 4, you can just 2 hours out of your 24 hours. You can snore for 12 hours. That's your business. Go to your lecture, finish your job, do that. Watch 3 hours, do that. I'm going to share this prompt on the group for some of us that join the session. I'm going to share it on the public health group. I'll share it on my YouTube channel. This video is going to be made accessible out there for you all. And this is what it's going to do down till, I could continue talking about it down till 31. Who knows how fast you are in learning. If 1 month is too slow or is too much for you can try to prompt and say, okay, in 2 months, spread it out in 2 months. It is better that you're crawling than you are not walking. So everybody should be making movements. It's better that you're walking or you're running or you're staying at one place. At least, even if you're crawling, even if the only thing you achieve the goal of 2025 is how to use Python. Trust me, you are way, way, way better than everybody. By 2026, you have a picture of what your life will be. But I can ask some people now a question. What is your 2026 going to look like? Not 2025, no. What is expected of your 2026? That is too much. Because already 2025 is anyhow it goes, public health, finish, get our graduates, do your convocation, mess yourself up, and maybe find yourself in any place, and that's it. So I want to really say a very big thank you to you all, and this is just it. And like joining community is also very important. If it was to be videos, I could actually edit this prompt as much as possible. You can actually get this code on the link below. If you're watching on Spotify, if you're listening to me on Spotify, anywhere you're listening, you can get the link to the prompts that I just gave down on the comment section. I'm definitely going to get it. And I think that is just going to be that. I'm going to entertain questions, a couple of them. I know we have lots of questions that we want to ask, just a few of them before we can actually get going. But before I do that, I'm just going to have a quick rundown on what we have just covered for the day. And something just very simple. We started by talking about artificial intelligence. Remember, if you're just joining, and we talked about some of the tools, the pathways, some of the key areas of AI in public health. What is trending? We looked at some of the things that are trending. We got generative AI tools like ChatGPT. We had some example, opportunities, ethics, how to get started, a roadmap. And we explained AI to be just that thing that can actually do what humans are doing. Like that thing that can actually simulate human intelligence. That's just what AI means. And we talked about some of the importance of AI in public health to be analyzing complex health data. We need data. In short, for AI to function, we really need data because we need data. Predict disease trends, some of the examples, outbreak prediction. Look at some of the areas for AI, so some of the areas in public health sciences, like diverse areas, because we already know the umbrella of public health covers diverse fields, reproductive health care, biostats, primary health care, and a wide array of them. We'll look at a couple of tools like AI softwares, like Python, R, and we've got Power BI, SQL, very massive for generating chatbots. Databases, very, very massive as well. Machine learning algorithms, natural language processing, and mobile health technologies. So we can actually get started with this. We talked about some of the key areas AI can actually contribute in public health, like drug discovery, very, very important. Health system optimization, not different from what we talked about already in the outline. Inside of there, where we talk about the need to know how to use a couple of these tools. And data analysis for public health, very important. Like you can actually start data analysis journey, you're going to make a lot of money. What is going to make you money now is what you can do at your comfort of your home. That's that's really what gets you money. You can build your house from the comfort of your home by doing something in public health. And trust me, it's something that's very possible. And key areas and tools of AI in public health: disease surveillance, outbreak prediction, personalized health interventions. Then we looked at some of the popular generative AI tools that you really need to know: Gemini and ChatGPT. When you look at tools like CapCut, like the CapCut you use in editing your twerking videos, when you're twerking, showing your dating ass. When you look at some of those tools, you'll find that there are AI bots now incorporated inside of it. So you can actually make massive use of it. ChatGPT, massive. Synthesia, Canva too, very massive. AI helps in arts, music, content creation, virtual world, fashion, fraud detection, healthcare diagnosis, demand forecasting, customer behavior analysis, and financial forecasting. This is where generative AI can really very much be applied. And also opportunities, data science pathway, which we have just explained. AI provides ample research and development opportunities in Nigeria, collaboration, massive. It also helps us in freelancing opportunities. Starting small is very important. You can actually become a freelancer, make lots of money, build a portfolio for yourself. I already talked about that. Ethics, very, very important for AI in public health. And we'll talk about security, responsibility, safety, transparency, bias, and fairness. I'll talk about, to get started, you need to know what you want. What do you really want? You want to take the data analysis part, data cleaning, visualization, basics are always very important. Learning Python is going to really help. It's a very simple programming language, data science language. We don't really need to take ourselves out from this, but we need to do it. Attach ourselves to this. And exploring AI opportunities in health, very massive. Chatbot building, make a lot of money, tons of money. Joining communities is very, very important. I've got a community out there for writers, systematic review network for low and medium income countries. You can always join if you're really very interested in it. Remember, if you attended this webinar, you've done yourself a lot of in short, you've really helped yourself more than thousands and thousands of people out there who feel like they're really engaging. So thank you very much for your time. in today's session on artificial intelligence in public health. I know we can't really wait to get started, and I just want to get some of our questions. So, Joy, you're raising your hands. Okay, we can come forward with a question. So, Joy, you can come forward with your question. Okay. Okay. Are there questions? I will want to invite I want to invite the Vice President to make a comment on this. We'll provide the slides, definitely. You can also always drop a message on the chat box. I'll always look at it. Okay, yeah, I'm going to paste the prompt on the chat box right away. I'm going to do that, and I'm doing that right now. I know most of us want to really take our life very serious. Please check on the chat box. You will see that I have already pasted the information there. So I don't know if there are questions. I'm sure we really had a very massive session. Any insight? I want to hear from you guys. Chukwemeka Sontochukwu, how it was. Okay. Yeah, so it looks as though it was very satisfactory. Okay, yeah. So it's a pleasure to have each and every one of you. Once more, remember to always make sure you keep very much abreast with things of public health. Okay, yeah, somebody's asking a question. How can a public health professional, I can drop the questions on the chat, but somebody's asking how can a public health practitioner intercollaborate with other healthcare providers using AI? Yeah. It's just like we explained, most people in engineering, most people in computer science, when you have very massive skill on how to use AI, generative AI particularly, you find out that you can have a lot of role to play with some people that are working in other disciplines. Let's say, for example, in one of the recent grants that we got where we were awarded over $200,000, we had to collaborate with some other persons, some other companies, because AI was very vital in helping in matching images. It was very, very important in matching images of neglected tropical diseases. So in that scenario, you find out that it is very, very helpful. It was very, very helpful in doing that. So thank you very much. Thank you very much. If you have any question, you can actually ask before we carry the blast. I don't know if there are questions. Okay, Jane Kosey. Okay. All right.